So if you're like me, you've heard of Dysentery, mostly from playing Oregon Trail, that 1980s video game where you would put in your friends and family's names and then they would all die of dysentery on the Oregon Trail. What dysentery actually is an old-fashioned word for really terrible diarrhea. It's rarely deadly these days, but cases and case counts are rising in Multnomah County right now. And that's due in part to the really significant number of people who are living unsheltered on Portland Street. There's close to 6,000 people living outside in Portland, according to the county's latest estimates. The number of available public toilets is less than 150. The bacteria that causes what we're calling dysentery is called Shigella. Okay, so here's what the chart looks like. It's 19 in 2017, 58, 2018, 33, 87, 36, 43, 96 in 2023, 158 in 2024. It's crazy. According to all the people I've talked to who are following this from a public health standpoint, that's due almost entirely to the lack of safe and clean places for people living outside to use the bathroom. Oh, one really important thing to understand about the number of cases is that doctors think there's a lot higher number of cases than are actually being reported. Most people just kind of deal with this and get better eventually and don't actually go to the doctor. The absolute best way to avoid getting sick with Shigella is to wash your hands after you go to the bathroom and to go to the bathroom in the toilet and then flush it. So for the majority of people living in Portland, Shigella is not a major concern as long as you're washing your hands carefully and watching where you step when you're walking around places where there might be human feces. You should be good. However, if you do start feeling really sick and you have diarrhea and cramps and you're throwing up, it's probably worth checking in with a doctor and seeing what you have. For more on this, you can read my story on the spread of Shigella and dysentery in Portland at OregonLive.com/politics.